older adults, people with physical disabilities, as well as family caregivers. So we have a number of services. I could talk a whole hour about SECOA and what we have to offer. Jim knows that. We sat probably over an hour talking about everything. But this
I
is
also
just...
have your blog that I can share with people if people
That
want.
is so true, yes.
Yes.
Yes, thank you so much. And I just have to take a moment to thank Jim for inviting me here and coordinating all of this. So thank you for being a big supporter of Dementia Friends. So Dementia Friends is just one program that SECOA offers. So I'll get into that in a little bit, but why, as a 28-year-old, do I care about dementia? And why am I here teaching people about dementia? Well, as you can probably imagine, it's a personal fight for me. My grandmother, she's been gone 6 years now, but she had Alzheimer's disease. And now that I look back, I realize she was an early onset case. So she was diagnosed before the age of 65, and she was a rapidly declining case. Most cases of Alzheimer's disease, the average lifespan is 6 to 12 years. So most people don't realize that. So we had definitely less than 10 years with her, but just being there firsthand, experiencing this, and for 5 months I was her caregiver. So I provided the physical assistance for her activities of daily living, and I'm sure that will come back up. But I've lived this, and I've helped so many people over the 4 years that I've been at SECOA who are living this every single day. And so for me, I really just see myself as their voice. Not everybody's ready to get out there and share what they've been through or talk about this, but I am. And I have such a passion, and in my blog I stress this too about being proactive. We cannot sit back and wait for this to happen to us. We need to know the fundamental information, and I hope that's what you gain from this today, and just gain a different perspective about what this is and what these individuals are truly going through. So again, thank you so much for being here today. So go ahead and open your workbooks, and then if anybody does not have a workbook, just raise your hand and you can grab one of those. Perfect. So when I say dementia, what comes to mind? Feel free to shout out some words.
Older.
Older. I'm glad you said that. We'll get to that. Older adults.
Memory issues.
Memory issues. So older adults, memory issues, anything else? Some words that I typically will hear, confusion. Of course, memory loss is usually the first word that's thrown out there. I had Googled what words were associated with dementia because I was just very curious, very disheartening. But Google said isolation, delusional, craziness. I've also heard people say empty shell. I've also heard people say the longest goodbye. So out of all these words that have been thrown out there, positive or negative?
Mostly negative.
Mostly negative. So I don't think anybody in this room would be surprised to know that dementia is the most feared health condition in our country amongst all ages. And why? Because of this right here, because all we know about it is negative. It's all doom and gloom. If people are sharing their stories, it's the heartbreaking ones. It's the ones that really kind of scare us. And I'm not trying to scare you into knowing this information, but the reality is nearly all of us have been touched by this, and if we haven't yet, we will be. And it might not be personally, but it might be through a professional manner that you're touched by this. So dementia is actually not a specific disease. So it is an overall term that we use to describe a wide range of symptoms. So memory loss is just one of those symptoms that's included. But again, just a wide range of symptoms that we associate with a decline in memory or other thinking skills that are severe enough to impact our daily lives. And so Alzheimer's disease, nobody threw that one out there, but Alzheimer's disease is just one form of dementia. It is the most common form of dementia. It accounts for about 60 to 80% of all cases. So we hear so much about,
I'm sorry.
Yeah.
I've ever since, for years
Yeah.
now, it seems like people want to use the term dementia almost more as a euphemism for Alzheimer's. Although I realize Alzheimer's can't be absolutely diagnosed, until after death, right? But maybe that's not true. But it always seemed like, well, you're saying dementia was like.
Well, and dementia is really, so it's almost like a fever. I think that's kind of the best way to describe what dementia is. So dementia is kind of like this fever. Well, what's causing the fever? The fever doesn't just stand alone. So you've got Alzheimer's disease that causes it. You've got vascular dementia that causes it. You've got alcohol-induced dementia that will that will cause these dementia-like symptoms. I mean, there are over 100 different medical conditions that can cause dementia. And so I think a lot of people just default to dementia because I don't think our screening really is quite there. Our testing is really quite there. And like you're saying, you know, most people are being diagnosed with Alzheimer's disease after they die. So, you know, I don't know if that really answered your question, but they're
I'm
not.
just curious, it just seems like people are afraid to use the term Alzheimer's.
Yes.
Like it seems to have
Sure.
a lot more negative connotation than just the general term.
Sure, absolutely. And I think we talk so much about Alzheimer's disease again because that's the bulk of all cases, is this. And I think, again, that's because our screening, our testing is kind of focused more on that, but we've got hundreds of other medical conditions that we need to be looking into. So many people are just diagnosed with dementia. And I kind of push back on that saying it can't just be dementia. There's something causing that, so we need to look a little bit deeper into that. So the most four prevalent cases, again, Alzheimer's disease, dementia with Lewy bodies. I don't know if anybody's heard of that one before. Frontotemporal dementia, and then vascular dementia. So they all have their little quirks about what sets them apart from one another. But the hard thing is they mimic each other very much. So that's what's difficult is they do have so many symptoms that really do coincide with one another, but there's always that one hallmark that kind of sets them apart. So if you want more information, more details about that, I'm happy to connect you with that after this presentation. But the overall mission of the Dementia Friends movement is to increase your understanding, but ultimately reduce the stigma associated with this condition. So on page 2 and 3, you'll see a little bit more information here. But Dementia Friends, this is actually a global movement. So it did not start here in the U.S. The U.S. is actually a little late to the game as far as adopting this movement over here. But this originated in 2013 in the United Kingdom. So the Alzheimer's Society really championed this program and started kind of, I don't want to say selling it, but passing it off to other countries. Right now, I believe there's over 45 countries who have adopted a Dementia Friends program in their country. So that's exciting. We are just one of 45 different countries. And so with Indiana, we are actually the 10th state here to adopt this movement. So I don't know if any of you are aware of where Indiana ranks as far as long-term care services and supports go. We are the very bottom. We are the very bottom. We are behind Puerto Rico. Yes, just as we all know. Yes, I mean, yes, absolutely. This is something that is very real.
What do you mean by we rank at the bottom?
We are, as far as the quality of our long-term care services.
We don't have enough, or what we're doing is not good?
I think it's just,
everything?
I think it's all in one.
And is
There's
that
certainly
ranked by
not
the
enough.
federal government? Is that?
Wow. So.
I guess I wouldn't have thought
That's a little
that.
disheartening.
Especially Louisiana.
So, that's why I brag about us being one of the
We're all
top
right down
10
there fighting for
states
the
to
bottom,
adopt
like
this
Mississippi.
movement. Because obviously we've got a lot of work to do, but at the end of the day, this comes back to understanding and awareness and taking action to do something about it. Because again, the sheer number of people that are going through this and the caregivers, that almost triples that number of people caring for them. We need to do something. And I think it's like it's almost like the AIDS and HIV movement way back in the day. Severely misunderstood, all these misconceptions, all this stigma. But you started to educate, became aware of what it was and really what it wasn't. People were able to start getting connected to different resources. And it just comes back to that, just an understanding and an awareness of what this truly is and what it is not. So you will see there's a colorful sheet in there, and that's really just the vision of a dementia-friendly community. It really takes all of us. It's not us just working in this industry. It is not just our hospitals and healthcare systems. It is every single person. It is our bank tellers that are coming into contact with these individuals on a weekly, if not a daily basis. It is our faith communities who are often the first people that these families are turning to for help or to admit that this is what's going on. And so it really takes a village, a community to understand this and to start making some accommodations. So we're not asking you to just, tear this building down and build it back up so it's dementia friendly. No, but to take a look at what small actions can you do to provide a better, a safer, more conducive environment for these individuals. So I'm going to talk a little bit about normal aging versus Alzheimer's disease. And so I'm going to kind of shift to talking a little bit more about Alzheimer's disease here. So most people are aware of the physical changes that we experience as we age. The hair starts to gray a little bit, you start to feel a little stiff. I know my neck every single morning, I'm like, holy cow. I wish I could just go to sleep and wake up and not be so stiff. So we're aware of those types of changes as we age, but we also experience some cognitive and thinking skill changes, and they're not always going to progress to the form of dementia or something more severe. But again, we all experience becoming a little bit more forgetful or just kind of confusing appointments throughout the week. So I'm going to talk to you about what are the 10 signs and symptoms, and then give you examples of what normal aging would look like. So hopefully I do not scare you all. Most people are like, oh, check. I'm not here to diagnose, I promise. But if you are sincerely concerned about some of the things I'm talking about, talk to your doctors. Because a lot of people, and I know it's so much easier said than done to express what's going on, but your doctors are not going to ask you. They're not going to probe to try to find out this information. You have to come saying, I really am just having a hard time. I'll walk into the room, because most of us will walk into a room and forget why we're in there. And then you walk out, and as soon as you're walking out, you turn around and I remember again. But maybe you get to that point where you are just not able to recall that information anymore. And so reach out to your doctor, talk to them about that, because the sooner you bring it to their attention, the sooner a possible diagnosis, or they can rule that out and say, hey, we just put you on a new medication a couple months ago. Maybe that's what's going on. So there's a number of different factors, so rule that out before that diagnosis. But the best person you can talk to, of course, is your doctor. So the first sign is memory loss, and I believe that is what you shared with us, and that's what most people think of when I talk about Alzheimer's disease or dementia. So memory loss, of course, that's the most common sign, especially for getting that recently learned information. Others include forgetting important dates, so maybe they don't remember their wedding anniversary anymore, or even that it's their birthday. And asking for the same information over and over and over again. Anybody who's dealt with a person living with some form of dementia, you know that. You know that that's a sign. And then relying on memory aids. So whether this is just a reminder note or an alarm that goes off every day at noon saying it's time to take your meds, or a family member physically handing those medications to you, they rely on somebody to really take care of these everyday activities. We call them instrumental activities of daily living at SACOA or in the Area Agency on Aging world. So a lot of those instrumental activities of daily living, they require somebody else to help with. So what's normal aging? It's normal to forget somebody's name when you first meet them. Yes, you're like, phew. It is normal to forget appointments that you may have made. I think it's just so common for us all. We have so much going on in our daily lives. It doesn't matter if you keep it all on a calendar or not. You're bound to just get things confused every once in a while. And that's just your work life. And then you add your home life on top of that. So again, just to ease your minds, something like that would be completely normal. But again, the hallmark, you're able to recall this information. You're able to remember this information down the road. The second sign is challenging in planning or solving problems. So some people may experience changes in their ability to develop and follow plans or work with numbers. Financial management is typically one of the first indications that something is going wrong. People stop paying their bills. Whatever the case is, it usually boils down to financial management is a big sign. So they also will have trouble following familiar recipes. Or keeping track of their budgets. And so they have difficulty concentrating, and it will typically take them much longer to do things than it once did before. So what's normal aging? I love this example because it just isn't all that relevant anymore. Does anybody balance a checkbook anymore? And I've looked, these come directly from the Alzheimer's Association, and they still use that example. So maybe one day, maybe 2020, we'll update that and come up with a better example, but most people don't balance a checkbook anymore. But you kind of get the gist. So occasionally making an error when balancing
Do not
a
make
checkbook.
that joke with a client. I said something about that to somebody not too long ago. Well, I still like soup balance. Did
Yeah.
you check the register?
Oh, I had somebody in their 30s raise their hand, and I was like, you go, girl. Good for you. I rely on online banking. But the third sign is difficulty completing familiar tasks at home, at work, or at leisure. So people with Alzheimer's often find it hard just to complete daily tasks. So even as simple as making a sandwich for lunch or brushing your teeth, something that we've done all of our lives, can become very challenging. So sometimes people have trouble driving to familiar locations. I can talk about that for an hour or two. Managing budgets again, or remembering the rules of a favorite game. So we've heard a number of stories. I know my time at Sitco, I've had a number of phone calls talking about, they just went down the road, they were going to the gas station or going to their favorite little diner for breakfast and wound up a couple hours away, or sometimes even in another state, just because they were unaware. And this always makes me think of Still Alice. It's a book, and then they made a movie out of it. But she goes on this job, same route she takes every single day. She gets to a point where she should be turning around to run back home, and she can't recall how to get back home. So it always makes me think of stuff like that. What's normal aging? It says on occasion needing help using settings on a microwave or recording a television show. I would even say using a smartphone. Our older generations, I know there are tons of classes out there for them to learn how to use their smartphones or learn how to use the internet for certain things. So I would say any advanced technology, of course with older adults or with other generations, anytime something's new, it's kind of hard to learn that. So not a big deal there. The fourth sign is confusion with time or place. So people with Alzheimer's disease often lose track of dates, seasons, passages of time. So if you were to ask them what year it is, quite a few of them would not be able to recall that it's 2019 or who the president is at this time. They just have trouble understanding things if they're not happening right at that moment. So what's normal here? That would be getting confused about the day of the week, but again, able to recall that information later. The fifth sign is trouble understanding visual images and spatial relationships. And I think this one can be kind of tricky because I think, as we age, we associate aging with decline in vision or with vision loss or cataracts. Cataracts are completely normal. But what I've found is with these individuals, oftentimes it's not their eyes that are unhealthy. It's in fact the brain. The brain that processes the information that our eyes are seeing, that's what's impacted. So again, a lot of times you're not going to be able to pick up on this on a typical eye exam or something like that, because again, it's our brain that's not able to process the information that our eyes are seeing. And another helpful thing to understand the way that it impacts our vision as you go through the different stages of Alzheimer's disease. When you're in the early stages of Alzheimer's disease, it's almost like scuba goggles. So you've got quite a wide range of vision right in front of you, but of course you're not able to see out the sides, and of course your brain is not often communicating with you to turn around and to talk to the person that's trying to talk to you from behind you. So in fact, you've got quite a wide range still in front of you. And then you move to the mid to moderate stages, and it almost starts to close in like swimming goggles. And then you get to the late stages, and it's almost like a monocular, so the vision out of one eye. So you might still be able to see out of both eyes, but really you're operating at a capacity to only see out of one eye. So that's kind of a nice way to visualize the way it impacts our vision. So you can see where this would pose an issue with driving. Why it's so important for these individuals, while you may think that they're just driving 1 mile down the road, again, for many reasons, it's just not safe. And if anybody's going through that now and they're in the midst of trying to take keys away and you need some help doing that, I'm happy to talk afterwards, because again, I know that is often one of the most difficult conversations you'll have with a loved one, because it really is that first line of independence to go. You revoke the keys, and then they feel that isolation, that feeling stuck, and feeling that they don't have the freedom to go wherever they please. But again, they're having trouble judging distance, determining color, contrast. So again, it's not safe. And again, normal aging, cataracts. So the sixth sign is new problems with words in speaking or writing. So people with Alzheimer's disease will often have trouble following or joining conversations. They may be talking along, but just get in the middle and have no idea what they were talking about. And even with a little bit of prompting and cueing from others, they're still not able to remember what they were talking about. They may struggle with vocabulary, so word finding can be very difficult. So something like a watch, they might call it a hand clock just because they can't find the word watch. I think we've all been there, and that's what the example is, normal aging, just having trouble with word finding. We've all been in that situation. You're like, what word am I trying to use? That's normal, but again, being able to recall this information is really the key. The seventh sign is misplacing things and losing the ability to retrace steps. So a person with Alzheimer's disease may put things in unusual places. They may lose things and then be unable to go back and retrace those steps. So we've heard a number of those stories, whether they were hiding some money, hiding some jewelry, hiding something of value many years ago, and then they've developed this brain disease and they're no longer able to recall where that is. And that can lead them to being suspicious that other people are stealing from them, that paranoia that they're just in a vulnerable situation. What's normal aging? I think we've all misplaced something from time to time, whether it's our glasses, whether it is our wallet or keys, anything, our phone, anything we need to walk out the door. I'm sure most of us have misplaced something, but again, with a little bit of time, you're able to recall where it's at. So the eighth sign is decreased or poor judgment. So people with Alzheimer's disease may experience changes in their judgment and their ability to make decisions for themselves. So for example, a lot of these individuals will use poor judgment when it comes to money. So whether that's a telemarketer, there's a number of different phone scams out there. We're all susceptible to that, but especially these individuals who don't have the capacity to judge these situations for themselves. But a lot of times, just giving large amounts of money away. So again, telemarketers calling, people just showing up on their doorstep promising to take care of, to cut the tree in the front yard down, but they need $10,000 before they leave. And again, their brain does not have the capacity to say, this is not a safe move. So you can see where they just can get themselves into these financial ruts. This also goes with personal hygiene and grooming. So, many people will say, gosh, I really knew something was wrong when mom, we were going out to lunch one day and she didn't even notice that she had dribbled some breakfast down the front of her shirt. She didn't bother to change. Where before she would never be gawked at in public without being dressed to the nines, makeup done, nails done, all of that. But again, they were able to start picking up on it because she didn't notice just the simple thing of just, dropping some food down the front of her shirt, just not to make the connection that, I gotta go change now. I'm about to go out to lunch with my family. So little things like that, or thinking that they have taken a shower. They just took a shower 5 minutes ago when you've been visiting every single day for the last week, and darn right that they have not taken a shower. So again, just many different situations where you can see that this is an issue. So the ninth and the 10th sign, I'm gonna try to keep it very short, but just to kind of share, what my family went through, and how these were really two of the major signs that we've missed with my grandmother. But the ninth sign is withdrawal from work or social activities. And so a person with Alzheimer's disease might start to remove themselves from those hobbies, those social groups that they were once a part of, work projects, sports, anything like that. They may have trouble keeping up with a favorite sports team or even remembering the rules of a favorite game, favorite hobbies. And they may also avoid being social because of the changes that they're experiencing. And I think that's a big one, and I'll come back around to that. So with my grandmother, she was very involved in church, like many people are, but she just lived and died for this church. She did so much for this church. And so every Sunday we lived about an hour away, but we'd give her a call and say, hey, we're getting ready to come in, we'll pick you up. And it just became, week after week, the same excuse. I'm not feeling well, I'm not gonna go this week. So we'd say, okay, throw our nice church clothes off and get back into our PJs and enjoy our Sunday morning. But it became months down the road where it was still, again, the same excuse. And we just thought, gosh, this is so strange. You know, she never missed church unless she was like in the hospital sick, kind of missing church. So it just became very strange to us. And again, she was very social. Almost every single weekend she was meeting up with a friend. They'd grab breakfast, go shopping all day long. And so that just became few and far between, where she would just not, she just wasn't social anymore. And it was really strange for us to see this woman who, I mean, like all of us, we all thrive off of connection, but especially her, because she was a babysitter, so most of her time was spent in her home, raising kids. And so she really just, she needed that time away to get out of the home. And so it was just so strange to us that all of a sudden these things that were once so important to her just didn't really matter anymore. But again, she kind of hid it from us by saying she's just not feeling well, and that's why she's not doing this. So it says here, you know, what's normal aging? I think we all feel weary of work. We all feel weary of you know, plans that we've made. I know for me, often I don't really make plans with people anymore because I just know I get to the end of my week and I just want to sit on my couch and just turn my brain off as much as I can, you know, without turning it totally off. But the last thing I really want to do is be around people after I go to bed with people all week long. So that would be normal. But it's that persistent, you know, pulling yourself away from things that were once so important to you. And again, you know, they may avoid being social because of the changes that they're experiencing. So one, maybe they haven't been diagnosed yet. So they know maybe that something's not right. But again, they don't know what's going on. And so they don't want that secret to get out. They don't want somebody to say, hey, I think it's time that you go have a conversation with your doctor. Because again, we all think that we go, we're going to get diagnosed, we're going to lose our independence, we may be thrown into a nursing facility, just all these misconceptions about what may happen if we're diagnosed with this. And you'll see a lot of couples too. I mean, just so many people hiding this information. And I think it boils down to the stigma that's associated with it. People just don't feel safe, that they can express what they're going through. And that, you know, just that fear of if I tell people, they're going to walk away. My friends, my family, this may be the last time that we really spend time together because they don't know, they don't have just the basic knowledge for how to communicate and how to interact anymore. So the 10th sign is changes in mood and personality. So the mood of personalities with people with Alzheimer's, they change all the time. They might be suspicious, they might be depressed, they might be anxious, just anything like that. They may be easily upset at home, at work, with friends, but especially in places where they're out of their comfort zone. So even if it's a place, you know, as this seems to progress, you start taking them to a place where they go once a week. You know, after a week passes, they may have forgotten that this is a familiar place to them. So usually that place of home is really that only familiar place or that comfort zone to them. So you might see some behaviors start to spark up a little bit when you take them from that comfort zone. And so here, with mood and personality, and I want to just focus on the depression piece. So this was another thing with my grandmother, and it was right around the holidays, and I was just talking to my mom about this weekend, because, you know, we had kind of noticed she was having trouble following the recipes for making Christmas cookies and things like that. So we started to notice, but my mom had shared this with me, and I didn't even think about this earlier. But there was one year around Christmas when my grandmother was like, she wasn't going to decorate for Christmas. And again, if you knew this lady, I mean, the whole house was just decked out by November 1st. I mean, she just went all out. Christmas was her very favorite holiday. And she just got to this point where she wasn't going to decorate. She was trying to give all of her decorations, everything away to my mom, to my uncle, to other family members. And then we were just like, Mom, we will decorate for you. You know, this is not a big deal. You do not have to do anything, but we're going to decorate. And just little things like that, something that you're like, what in the world? This is so strange. She's not acting like herself. But now you look back and It was, I mean, that next year, over the next year, we had received the diagnosis that she had Alzheimer's disease. So, you know, just things like that. I mean, just things that we think are so strange and something that we may never make a connection back to, hey, this might be a sign of some form of dementia. So again, you know, I hope that you take this information and I don't scare you, but you start to pick up on signs. And if you see things that are really out of the ordinary, you tune in a little bit more. And maybe you just bring it to their attention that, hey, I'm starting to notice this with you, and I'm a little concerned based on what I know about dementia. Is this something you might feel comfortable taking to your doctor, you know, if things start to progress? If it's just, and that's the hard part too with the signs, is because things will just happen sporadically. It's not always a consistent, you know, every day you're seeing this. It might be a month, and then a couple months go down the road and something else might happen. But just to start to pick up when you do notice these things, not to jump to the conclusion, but to also know that, hey, I'm going to check in a little bit more often than I do, and I'm going to start to make myself a little bit more aware of who the resources are and who I can turn to for more questions.
What do you do if what does somebody do if they are diagnosed as their,
We'll get to that.
Oh, okay.
Yeah.
Well,
And so
there's the
that,
whole big denial thing too. Like
Oh,
my mother
absolutely.
never, like, Mom,
Yes.
really? No,
Yes.
not me.
Yes.
I don't do that. It's like, oh
Yes.
my gosh, she just denied everything.
yeah, absolutely. And that, of course, makes it even more difficult because
Yeah.
you've got a lot of people that it doesn't matter how obvious it is. There's some people that are just so stubborn, are going to dig their heels in and just deny that this is their reality. But of course, I think it all stems back to, again, just the stigma and just this misconception that I'm going to lose my independence if I am diagnosed with this. And that's where agencies such as SACOA and the Alzheimer's Association and a number of other resources, they exist to help keep you in your home. So, yeah.
So a lot of these symptoms and whatnot kind of seem to sound a little bit like ADD and things like that, especially, I mean, is there any correlation between?
That's a good question. I don't know that, but that's just where I encourage you, because it might not. You might exhibit some of these signs, and then you might get tested and find that it's not this, but you might find that there's something else going on. And so I think, I hate to say it like this, but it's like, gosh, at the end of the day, if you can kind of get to the root cause of why you're experiencing some of these symptoms, to me, that would seem to be beneficial to most people. But a lot of people are also like that. They don't want to accept that this is their reality and what they're experiencing. And at the end of the day, they have that right to make those decisions for themselves. So that's a good question.
My grandmother almost made a joke out of it.
Yeah.
Says, oh, it's my Alzheimer's coming on.
Absolutely.
Alzheimer's,
And we are.
she
Oh.
just blow it off.
I'm so glad you brought that up, because that's leading us into our next piece. So
It's twice.
I'm not gonna, because of this, for the sake of time, I'm not gonna give you, we're gonna actually walk through these key messages here, but this is really what I want you walking out of here today, understanding and sharing with other people. So you'll see 2 columns. I'll go ahead and just give you the answers for now, just because I wanna make sure I have time to cover everything. So that first key message there, it should be B, but it's that dementia is not a normal part of aging. Not everyone who grows old will develop dementia, and I think that kind of speaks to what you 2 gentlemen said in the back. When you think of dementia, you think of older adults, or you think of older people, and just the same with you. People making jokes, oh, this is just my old timers, and people think that this is just a normal part of aging, that this will happen as they get older. And yes, it's more common amongst people 65 years and older, but not every single one of us will develop dementia as we age. And again, ruling out, if this comes on all of a sudden, if you're noticing these signs very suddenly, that's where, again, I would encourage you to reach out to your doctor, because it could be a medication. It could be an infection that's causing delirium. Again, there's a number of different reasons why you could be experiencing something like this. So rule out the fact that this is something that could be treated, such as changing your medications, or such as identifying that there's a urinary tract infection that's causing delirium, something like that. So rule that out. Dementia is caused by diseases of the brain, and so that would be A. So does anybody remember what the difference between dementia and Alzheimer's is? The difference between dementia and Alzheimer's. So remember, dementia is that collection of symptoms that includes memory loss, mood changes, just working with numbers, comprehension, judgment, decision-making skills. So those symptoms that they're exhibiting. So again, it's that collection of symptoms. It's kind of that one word that we use to describe all of those symptoms. And then you have Alzheimer's disease, which actually is the cause of dementia for about 60 to 80% of all cases. And again, that's just one type of dementia. And so what Alzheimer's disease, it actually changes the chemistry and the structure of our brain. So it kills our brain cells off, so they're not able to fire back and forth to each other and tell each other, to lift our arms, to brush our hair, to put clothes on. So that's where, you'll see a lot of these individuals progress to the point that they cannot manage their activities of daily living on their own anymore because this is a degenerative brain disease, essentially. So you'll see a picture in a little bit, but that outer part of the brain really just evaporates almost. It just disintegrates. And so we'll come back to that. So that is what you'll see. And again, just knowing that Alzheimer's disease is the most common form of dementia. 3, dementia is not just about having memory problems. So that would be E. And so people often think of dementia as a form of memory loss. Yes, and of course that is typically the most common sign that we see. But again, this impacts the way people think, the way they act, the way that they speak. 4, it is possible to have a good quality of life with dementia, and that's C. Most of us have this image in our mind, and I think most of us are thinking about those advanced, those late stages. I don't think that people often would be able to identify these individuals in those early to mid stages because oftentimes they're still able to function, they're still able to bathe themselves. They might need some prompting and some cueing, but for the most part, they can carry out their activities of daily living on their own. So that's where it can be very tricky for a lot of people to pick up the fact that, I might be working with somebody with dementia. Because again, on the outside, they look physically healthy. But again, if we could see the brain, it would show a much different story. And then 5, there's more to the person than D, the dementia. So in the same way we see people with cancer, the same way we see people with diabetes, we don't judge them and define them by their condition. We see them as the person first. And so for so many people, they think it's that empty shell, that they're really no longer there, but they certainly are. And you'll learn that what really remains to the very end is their ability to feel, or their emotions. And so that's where I would really come back and say, they are, for my grandmother, Pat. She was Pat until the very end. There were so many things that you turned on music and she still danced the same way she would, even in her healthy days. So they are very much still that same person. Although their functionality really falls away, that heart is still in there. And they're still able to feel, they're still able to love, and they need to be supported. So I want to go over just a couple quick bullet points about the impact that this has on family caregivers. So often we're so focused on the person with the pathology, with the diagnosis, but often we don't think about the family member or the team of family members who are really truly providing this care for individuals. So you'll see on page 7 there's a whole list of different statistics, but I just want to point out a few. So about 80% of people living with dementia are actually cared for in their homes or in a community-based setting. So they're not locked up in nursing care facilities or memory care units like most people think they are. They're still our neighbors. They are still living in our communities. And even assisted living, we still consider that to be a home and community-based setting. So 80% of these individuals are cared for in the community. 1 in 6 millennials, so I don't know if anybody else is a millennial, but 1 in 6 of us are primary caregivers for somebody living with dementia at this time, and report, of course, mental, physical, and financial hardships as a consequence of their caregiving role. So you think about these millennials like me, you're coming out of college, you have thousands of dollars in student debt. You're trying to get your first full-time job and make your living, but here, you go to work all day and return home, and you're working another full-time job, providing care to your loved ones. So, that's just a small portion of people. So we're just talking about millennials. I'm not talking about all of the sandwich generation, as they call them, so the people that are raising children while also raising and caring for their loved ones who are older adults. So this just has such a significant impact on caregivers. And then the last one I want to point out is that very last bullet point that says spousal caregivers of individuals with dementia ages 66 to 96 have a 63% increase in mortality rates than non-caregivers of those with dementia in the same age range. So what does that mean? Oftentimes we're seeing the caregiver pass away before the person with the dementia. 63% of the time that is happening. And we've had many people come forward after this and say, I know so-and-so, that happened to them. I mean, with my grandfather, I think the one thing that saved him truly was that he had such a great relationship with his doctor, that he was in seeing his doctor all the time. Because we found out he had to have quadruple bypass surgery on his heart, right in the middle of his caregiving role. I think this was about a year or two before my grandmother had passed, but she was really declining. So it's like, gosh, if he would have neglected his health and not been going to the doctor, he probably would have had a heart attack and he may not have survived. So, I mean, so many of these caregivers, again, they're just trying to make sure that their loved ones' needs are being met. And so oftentimes they just allow, themselves to neglect their own health, and it gets them in this crisis situation. So many caregivers are doing this work because they want to honor their loved one. They want to keep them at home. And they want to be that person providing that care, and that's respectable. But at the end of the day, if you're not setting yourself up, health-wise to be successful, then you run the risk of, them going into a nursing facility or one, if not both of you, going into the hospital. So everything that they're really trying to work to prevent, they end up putting themselves in that situation anyways because they neglect their own health. So this is not just a one-person health condition. This affects everybody who has their hands in the caregiving piece of this. So quickly, I'll go through the bookcase story. And so with this is not a scientific explanation by any means, but I think it will help you understand the way that the brain is impacted when one has dementia. So everyone's brain is affected differently by dementia. For now, let's imagine a 70-year-old woman who has dementia, and then imagine that there's a full bookcase beside her. Each book inside the bookcase represents one of her skills or memories. So on the top shelves are her memories of facts and her skill for thinking in complex ways. For people living with dementia, the top or the outer part of the brain is damaged first. So skills such as math, using language, keeping one's behavior in check, all reside in this part of the brain. So again, in our bookcase story, those are the books on our top shelves. When dementia rocks the woman's bookcase, the books on the top shelf begin to fall out. The woman may not remember what she ate for breakfast, or that she has to pay for items at the drugstore, or that someone came to visit her this morning. Emotions and feelings are lower down within the bookcase, just like they are in the lower inner part of the brain. So this is our instinct area of the brain. This is where feelings like love, happiness, frustration, sensing respect all reside here. So as dementia continues to rock her bookcase, the books on these lower shelves will stay for a much longer time. The bookcase story helps explain different thinking skills and memories and the effects of dementia. So again, facts and thinking fall away quickly, while emotions and feelings remain for a much longer period of time. So if we return back to the 70-year-old woman for an example, and this is what would happen with my grandmother too, when she started to really advance. I would show up for dinner. She had no idea that I was Melinda, her first granddaughter. She didn't know the facts. She didn't know why we were related. But I tell you, every time I walked into the room, she just sat up straight. She got the biggest smile on her face, and you could just tell it was like she came to life. And again, I think it's because she sensed that love. She sensed that support. She sensed that safety, almost. Where on the other hand, if we had a tumultuous relationship throughout our many years together, and I had, belittled her or made her feel poorly about herself, she would probably have the adverse effect. She would probably, just kind of like a child, just like have a scowl on her face, or she might even become very scared if I were to walk into the room. So again, those feelings, those emotions, they stick around for a much longer period of time. So again, that's where I push back on you. And when you say, they're just not who they are. They're not who they once were. And although their functionality has changed drastically, they are, at the end of the day, still that same person. And they deserve that respect. And they deserve for us to understand what they're going through. So you will also see here some other cognitive skills that are affected by this. Planning. So what is planning? That's the skill that we use to carry out our everyday activities. And then judgment, of course. And that's how we keep ourselves safe when we interact with others. So I'm going to talk a little bit about those, but we're also going to talk about communication. And I'll give you just some very straightforward tips to use. But you will be able to see that picture of the brain. So you see the healthy brain versus the brain with Alzheimer's disease. And that pretty much sums up the book story, or the bookcase story. That whole outer part of the brain no longer exists. So you can see just how that does impact them. So, real quick, if you guys would just take a moment on that blue sheet to write down every step it would take to make a sandwich. So I want you to write a list, an instruction list, of every step it would take in order for you to make a sandwich. I know it seems very elementary. I'm only going to give you a few minutes, so I know you won't complete your list. And you can choose what sandwich you want to make. Whatever sounds good. If it's peanut butter and jelly, my favorite is salami and mustard. Weird. So whatever you're craving right now. One more minute to wrap up your list. Like I said, I know you haven't completed every step, but just to get an idea of where to start. Back to the last piece.
Exactly right. You almost made me switch to salami.
Did you?
That's
Do you like that?
Absolutely.
Like, am I a weird person who really loves that? But all right, go ahead and wrap up whatever step you're on. And then if I could have a volunteer, share your first step with the group. Don't be shy.
Sure.
Sure.
So I chose a BLT. First step is to open the refrigerator. No, I'm just kidding. First step is to cook the bacon.
Cook the bacon. Interesting. Does anybody think a step comes before that?
You gotta get the bacon out of the.
Open refrigerator.
Open
Yeah,
refrigerator, open-
we didn't have that much time. Come on.
Open the package,
We didn't have that much
get a
time.
frying pan
Do you know
out,
what room we're in?
Yeah.
get to the kitchen.
Go to the kitchen.
Have you thought that you're even hungry and you need to make the sandwich?
Oh, you already told us to make a sandwich.
I told you. Yes, you're right. So you knew that, right? But exactly, so just getting you know, and I loved how you said, oh, I didn't go into that much detail. That's exactly what I was looking for. So do you think that looking at your list, do you think that there are steps that maybe are at least 1 to 2, maybe 3 steps all combined
Sure.
into one?
Absolutely.
Absolutely, absolutely. And so just getting you guys to understand that while we are able to comprehend multiple steps at one time, these individuals likely are not. So you have to really be very straightforward about, okay, stand up, we're gonna walk into the kitchen, and that might require you to walk them to the kitchen. They might not be able to know where the kitchen is. So then once you get into the kitchen, then you start your routine. But again, one single step at a time. So, you know, getting the bacon out and putting it in the frying pan, you know, breaking that down. Pull the bacon out of the drawer in the fridge, you know. And then we're gonna turn around and we're gonna grab the pan out of, so you can see how just tedious this can be. So something that we mindlessly do every single day. The other task that I give you is to brush your teeth. Something that I hope you all do every single day. But again, you know, how many of us just roll out of bed, walk to the bathroom, and just go about our daily business? And does anybody ever stop and think how many steps it actually takes you to do these tasks? No, because we don't have to. But that's, again, just us, you know, being fortunate and having that luxury of not having to be, you know, so direct with everything. And we can just carry this stuff out, and it's just like second nature to us. And I think that's where a lot of caregivers, a lot of family members really struggle when these individuals get to this point and they're no longer able to carry out these activities anymore because they've done them their whole lives. And so it's almost like teaching a child again how to do this stuff. But again, understand that it's the facts. You know, when they learned how to do this stuff way back in the day, that part of the brain may no longer be there. And so that's why they're not able to carry this out anymore. So you can see where simple tasks like this become very difficult for these individuals. So be mindful about that when you're interacting with them or caring for them. So last, we're going to talk about communication, just a few things here. So the ability to exchange ideas, wishes, feelings, that is a basic need for each and every single one of us. Communication with a person with dementia requires patience, understanding, and good listening skills. So when we talked about the book case story, we talked about how a person might feel as the changes with dementia continue to affect their thinking. So one of those skills that has greatly changed is the ability to communicate, both voicing or expressing their needs and understanding what's being asked of them. So as we talk about communication, keep that in mind. So changes in ability to communicate are unique to each person, but they may include using familiar words repeatedly, inventing new words to describe familiar objects, easily losing their train of thought. Maybe they revert back to a first or birth language, and having difficulty organizing words logically. So those are just some of the unique changes. They're not going to be the same with each individual, but very common changes that occur. And so I want to talk a little bit about behaviors too. So you might notice that the person is more easily confused. Maybe they don't respond to what you're saying or what you're asking, or maybe they respond with a behavior. So, you know, every morning when you're trying to help them get their shirt on, maybe they push you away, and it's every single morning, and you are just like, what in the world? Why do they keep pushing me? You know, I'm trying to be very gentle, I'm trying to be relaxed and very positive with them, but they keep pushing me. Well, you know, start to notice that maybe it's right about here when they're starting to push, and maybe we start to think that, it's painful for them to raise their hands up over their heads. So again, they're not just pushing you because they don't want to get dressed. Maybe they're pushing you away because, ouch, it hurts. I can't raise my hands up over my head. So getting to, you know, understand the behaviors are often their only form of communication. And for a lot of individuals, it's, you know, especially these caregivers, just not understanding that and just thinking that their loved one is trying to harm them. And oftentimes it's not the case. Of course, you have people who progress and can be very combative, can be very aggressive, and depending on what type of dementia they're dealing with, that can be very common. But if it's just, you know, the same, it seems to be the same time every single day, maybe we start to think a little bit, part of being a caregiver or dealing with these individuals is being an investigator. There's so much, you can't take it at face value. You really got to dig and find what's beneath the surface to understand what they're trying to say, because they can't verbally express. Ouch, that hurts. So a couple other things, when you're communicating with a person with dementia, please treat them with dignity and respect. So do not talk past them. Do not avoid talking to them. Even though they may not be able to comprehend what is going on, it is still important to keep them involved in the conversation. And as long as they're still able to voice some of those needs, they truly have the right to make decisions for themselves. So being aware of your feelings, your tone of voice communicates your attitude. I tell my boyfriend that all the time. It's like, I know you're not trying to get under my skin, but if you just check your tone a little bit before you come at me, things would be very different. So this is not just specific to dealing with dementia. Keep that in mind for everybody. But just using those positive, friendly facial features. Of course, that's not always going to be the case. You might be so riled up that you can't be the one to handle it. In that case, I would say it's okay to walk away, take a few deep breaths, and if you still can't calm down, you know what, just approach the situation at a different time. If somebody else is there, maybe they step in and try to help kind of de-escalate the situation. Being patient, being supportive, that's very straightforward. Letting them know you're listening, you're trying to understand, and just not interrupting them, especially if they're having a hard time, trying to remember what they were talking about. Just really giving them that space to try to think about it before giving them prompts and cues. Most people don't understand this, but if we give a direction or we say, hey, I need you to put your socks on, it may actually take up to 20 seconds for them to understand what you have said and to get out a response. So I know you all know how long 20 seconds is, but let's just sit here 20 seconds and see how long it is. So this part. That's 20 seconds.
Long time.
So we think of 20 seconds as being very quick, but in the sense of, so you're trying to get mom and get her up and get her ready for a doctor's appointment, and you're throwing socks and shoes at her saying, come on, let's go, I need you to get your socks and shoes on, we've got 20 minutes to get there. You've thrown 5 different things at her, and she's still trying to comprehend, you have a doctor's appointment today, or I've got to put my socks on before I put my shoes, so you can, again, start to understand why we can't just maintain the way we do things now, or the way we speak to our kids maybe even.
I just want to share, so when my mom was in assisted living, we took a class on dementia, and they were trying to tell us how to deal with it. And one of the things the woman said was, my mom used to ask the same question over and over, and my dad used to be like, Jesus Christ, Camille, you just asked me that.
I hear my grandpa
And
saying
so-
that.
Yeah, so this lady, she was like, to them, it's the first time they've asked.
Exactly.
So when you freak out on them on the 10th time, they don't understand why you're being like, whoa, why are you being so crazy?
Yes.
Well, to you, it's the 10th time, but to her,
Absolutely.
it was like the first time. So that was huge, because my dad used to get so frustrated.
Oh my gosh.
And he just didn't get it. We
Absolutely.
didn't understand that to her, it was
Yes.
the first time she was asking.
Yes.
We're like,
Yes, absolutely, and you don't know that, and again,
Yeah.
you don't understand that until you see just the way the brain is impacted, and understanding that those facts, and just those simple questions that they've already asked,
yeah,
is the first time for that.
right.
Well, and I think sometimes spouses are angry.
Oh, gosh.
Sure. I mean,
My-
there's more.
Oh, absolutely.
My grandma used to
But-
do
combination.
that.
Yes, but
She was just mad.
it's so funny when you said that, because I heard my grandfather's voice.
Yeah,
I mean,
Right.
literally, Jesus,
Uh-huh.
Jenny, that's what you always used to say. But yeah, you're absolutely right. And just bringing it back to a point where,
yeah.
all these things that they've done their whole life, we have to understand that's not the same brain that's in there
Right.
anymore. And it really boils down. But you know what? Every time he probably went off and got upset with her, it kind of scared her a little
Right.
bit. It was jarring.
Yeah.
You know what I mean? And so for us to realize that we can't just
Right.
can't just do the things we've always. We have to understand.
Yeah.
where they're coming from. Thank you for sharing that. Just to kind of wrap this up, I just want to leave you with a couple other things. So if you're with somebody who's having trouble communicating, just offering comfort, offering reassurance is always the best default. Avoid criticizing and correcting. Again, you've already told me that. This is the 5th time you're telling me this. Well, again, it's not. It's the first time in their mind that they're sharing this with you. Avoid arguing. One example that I'll never forget, I had a lady, she's dealing with this right now with her father, and she was taking him to a doctor's appointment. They were somewhere on the south side, on the highway, and he just looks out the window and says, oh, look at that beautiful ocean out there. And instead of her getting upset and saying, Dad, there's no ocean, we're in Indiana, there's no water around, she just went along with it. She said, how beautiful that ocean is, you know? And it's okay to do that. I think, we beat ourselves up that we're lying to them, or that we're, fibbing or manipulating them in some way, but the joy, and that's what she talked about, the joy of him thinking that there was an ocean out in the middle of this cornfield. I think anybody who's been through this, they would give anything to see that joy with their loved one again, and just to experience that moment. So, and like for us,
Time frame.
yes,
They think
yes.
it's 1920.
Yeah,
They think it's
go with
1920.
it. Absolutely. Absolutely. They want to go back to the Great Depression again, but exactly. So many of them, again, that short-term memory is gone, but those long-term memories, they stay around for a much longer period of time. So,
That's one thing that we struggled with in my family. My grandma, she would always think she had to get ready for school.
Sure.
And I would pretend when it was my turn, I would
Yes.
just go like, sure, yeah, we're getting
Yes.
ready for school. And my other family members would get mad at me and be like, why are you doing that?
Right.
Tell her where we are and what we're doing. And I'm like, I don't want to spend 20 minutes upsetting her.
upsetting
I'm gonna
her,
go with it.
she might forget it in 20 minutes anyways and start asking you again. So you did that right. My mom would say the same
reality.
thing.
It's
Yes.
us going
right.
into their reality.
That's exactly
instead of
what it
asking them
is.
to come to ours.
Yes, and the scariest thing is that people were taught back in the day to reorient these
Yeah.
individuals and to bring them back into reality. But
Yeah.
again, we have to understand this is their reality. This is what exists. And so it doesn't matter what our reality is when we're working with them. It matters what their reality is to them. So I'm just going to wrap this up very, very, very quickly by reviewing the 5 key messages. So you'll see you're going to take these workbooks with you. You can see there's more communication tips, and I would strongly encourage you to take a look at those. But for the sake of your guys' time, I want to just wrap this up here. So does anybody remember the 5 key messages? And I'll let you know they're right in front of you. So this is your test. Hold all hostage and keep you from your real work. No, I'll start it off.
Dementia is not.
Yeah, you start it off. Yeah, go for it.
Dementia is not, which one was it? Normal part of
A
it.
normal part of aging. And I think, to me, that's the most important one, because a lot of people don't even understand that this is not normal, right? The second one.
Dementia is caused by diseases of the brain.
Yes, dementia is caused by diseases of the brain. The most common is Alzheimer's, not old timers, Alzheimer's. 3, dementia is not just about having memory problems. It affects thinking, communication, and doing everyday tasks. 4,
It's possible to have a good quality of life.
it's possible to have a good quality of life with dementia, and I truly think that begins with people like us understanding what they're going through. And last, we can say it together, there's more to the person than the dementia. People living with dementia are a valuable part of the community. And so now I'm really going to just challenge you all to think about what small actions you can take in your daily lives to make a difference for these individuals. I think the biggest one is just telling them that there are movements like this that exist to educate people, that exist to make people aware of just how prevalent and how many people are being impacted by this. To share community resources. On the back of your workbook, you will see there's an evaluation sheet, but once you tear that off, you will see the number for the Alzheimer's Association. They have a 24/7 helpline. So if you work with these individuals, you please share that information with families because you just never know. I tell people, if you have a care manager at Socoa, they're not going to answer the phone at 3 a.m., but the Alzheimer's Association will, and they will coach you through whatever situation you're going through. So just being aware of that. I think I've also provided their website. And then below that, you will find SACOA's Aging and Disability Resource Center, as well as our website too, and then the Dementia Friends Indiana website. And the reason I only give you 2 resources, SACOA and the Alzheimer's Association, because right here in central Indiana, those 2 agencies alone can open a number of different doors for you. So those are really the gateways into the world of aging and long-term care services, and especially with the Alzheimer's Association, they are the ones who truly are the experts in this.
Is SACOA a state agency? Is
So-
the state of Indiana?
So SACOA is just one of, there's technically 15 different area agencies on aging, so we are one of those. So again, we just cover Marion
But
County
it
and
is a
Sedona
state,
County.
you are
But
a
it is,
state.
and actually triple A's they call them, not to confuse you with the insurance. But there's a AAA that covers every county in the country. So it doesn't matter what state you are in, what county you live in that state, you have a AAA that can provide just the basic information and referral services. SACOA is unlike a lot of other AAAs, just for the sheer fact that we're in Indianapolis, we cover Marion County. So we really have, a lot of unique services that a lot of them don't. But for the most part, they all exist to function as information and referral services. So great question. Yeah, absolutely. Well, thank you all. If you would just, go ahead. Yeah.
I was going to ask.
Yeah, of course.
There's no cure for it,
Nope.
and diagnosis is really symptoms that you diagnose, right? They don't do CAT scans.
They can. There are different kinds of scans that they can do. What I would suggest, sure you've got your neurologist, but if you can work with a geriatrician, and we have a number of geriatricians here in Indianapolis, I think that's really, because they are really, they call them 4 M's that they're really looking at, but what matters, and they're looking at mentation, they're looking at medication, they're looking at mobility. So geriatricians are really trained to work with older adults to identify memory issues, gait issues, a number of different issues like that. So there are screenings, but I've heard a lot of people, going to their primary care physician and it just kind of getting brushed off, and he'll come to, or whatever the case is. So that's where I would kind of, yes, bring the concerns to your doctor, but there are trained medical professionals out there to really do intense screenings for these different cognitive conditions. So you're not typically going to get that with your primary care physician or internist.
People, in talking to just the general public,
Yeah.
not your doctor,
Yeah.
they'll say, well, it's genetic, or they'll say, you drank a lot,
Yeah. Yeah.
alcohol,
Yeah.
or diet.
Yeah.
So,
It's-
saying that connected.
The research is finding that it's almost like your heart. It's the same kind of factors that we're finding. It's lack of sleep, it's diet, lifestyle, social engagement. I think we take so much of that for granted. We don't understand how important it is for us to connect with people on a daily basis. So social engagement is significant to our health. Sleep, exercise, of course. You were all hoping I wasn't going to throw that one into the mix, right? Gosh darn it! But that's really what the research is finding. So it's a number of different factors.
So alcohol is a huge.
Alcohol can but of course, that has significant effects on all of our bodies. So, but there is alcohol-induced dementia. So there's, it's hard. It's hard to know what are we, how do we keep ourselves safe? But what you have control over: sleep, diet, exercise, lifestyle, social engagement. At this point, that's really all we know to prevent it in the best way that we can. But it's the same way that we're going to care for our hearts. What's good for your heart is good for your brain.
I just want to share also.
Yeah.
She said something about, not arguing for 20
Yes.
minutes. I work in assisted
Yes.
living with memory care.
Wonderful.
And one of our biggest things, we say, we're independent
Yes.
memory care.
Yes.
So we're not skilled.
Sure. Yes.
We focus on what they still can't do. Because we focus on pushing them to what they can't do, they get frustrated and upset. If they want to go to bed instead of going to lunch, let them go to bed. It's a reset.
Thank you.
And then we've had someone that didn't play a piano for 5 years. We put a piano out there just to play it, and they just came out. It's amazing. And then we had someone that we just, they think are still going to work every day. We made them their own desk.
Yes.
We put their
Yes.
lamp and cell sheets, and he goes to work every day.
Yes.
It's just focusing on what they still can do.
I love that. Thank you for throwing that out there. I think we do try to push them to a point where they can. And any one of us is going to become frustrated when we're pushed into something that we cannot do.
And all of us have supplements.
And really honoring those lifelong routines that they've had. And not us getting so caught up in the fact that we're lying to them. They're not going to work. Little things like that. So I applaud you guys.
Well,
Thank you.
piggybacking off of that, if they don't have a purpose in the morning, helping
Yes.
them find one.
Yes.
So we've had clients who wanted to stay in bed all day, and we found out that they were retired firemen. And so we partnered with our local fire departments, and once a week we'll go and have lunch at the fire department.
That's so cool.
So if they don't have a purpose,
Yes.
on the flip side, helping them find one.
Absolutely.
And that's where we have some like memory boxes. And
Yes.
boxes.
Yes.
So, have that family bring 5 items
Yep.
that may have been from their childhood. Because when they're having an episode, you can pull something out
Yep.
that they know about and they can talk about it. And all they want to do is just sit and tell you all about it.
Yes.
So just focus on what they can do.
So Melinda, you made a point at the
Yeah.
beginning of the presentation that you're talking about early onset
Yeah.
and how typically early onset progresses a lot faster.
Sure.
And so some people can live with dementia for 20 years,
Yeah,
30 years.
absolutely.
Other people are dead in 6,
Yeah.
right? And what I've kind of experienced is that on the longer term ones,
Yeah.
it's not like a linear thing,
No.
right? So the lucidity,
Yep.
like you said, episodes,
Yes.
I think is the word you use. So I think sometimes
Yeah.
we're short because they've been lucid for the last
Sure.
3 weeks, and all of a sudden
Absolutely.
we come in and they're like, and they'll have an episode or feel that way, and your brain's not geared for it because it's
Yes.
not. It is like this.
Yes,
you know?
absolutely. So many good points thrown out there, and that's exactly it. I mean, you just all of a sudden you're hopeful, and you're like, oh my gosh, we've had 2 great weeks, things are going, and then boom, all of a sudden, So yeah, it's just like the gentleman that planned to be here to speak. You wake up in the morning, and it's just not a good day. I mean, every single day can be so different. But I applaud the 2 of you who work directly with these individuals and really making that effort, because not everybody out there is trying to be dementia friendly in that
And
sense.
one other thing that I kind of noticed is, people wait until it's too late.
Yes.
They want to wait until you're 80, 90 years old and you're exhausted to the point where you can't care anymore, and then you think you're throwing them into a memory care unit, they're going to be okay. They actually decline.
Yeah.
Sometimes it's better looking into your options ahead of time so that you're not going to this community and then you're unhappy with it.
Yes.
You take them to a new community.
Yes.
And all they're doing is declining each
Yep.
So
Yep.
look ahead. Whether
Absolutely.
it's 5 years ahead, if you know that you're on the border and you're not ready to put them in that kind of community, it don't hurt to look, to know your options.
And that's exactly it. Having a plan B, a plan C, a plan E, a plan E, because you never know when you're going into the hospital for quadruple heart surgery. Thankfully, we had family that could step in, but if there wasn't family around, we would have had to. Exactly. You don't want to just hope that the first memory care unit you visit is going to be the one. It probably won't be. It's going to take time to find a community that your loved one, that fits your loved one, rather than trying to fit them
And
into this
letting that
mold.
person feel like they have that choice,
Absolutely.
when they're capable of
Yes.
making that choice,
Yes.
that in itself makes it easier to transition.
Dignity.
Nobody wants to go into this nursing home. Nobody wants to do it.
Right.
I don't know, Stratford's pretty damn nice. I would love to live there.
We're like, oh yeah, I might move myself into
I'd be
there.
thrilled to live at the Stratford.
Well, if you have not already filled out that evaluation front and back, please do so. I left flyers. Again, we are trying to make 1,000 dementia friends here in the state of Indiana by the end of the month. So take those flyers, share that information. There's a list of community sessions that we'll be
So
hosting.
that you and everybody can get from that person, I'll get a picture.
Yeah, awesome.
And
I've got
I'll
the
go like
sign.
to do photos of the dementia friends. So.
You also said in the very, very beginning about Indiana being the 10th.
The 10th state to
What-
adopt a dementia friends movement.
So what does that mean?
So that means that we have implemented this movement statewide. So basically providing an education platform, a public awareness platform for people to have a better understanding.
Okay.
Yeah. So working towards, actually putting this into action and starting to see what dementia friendly environments look like. But I think before we can get to that point, we have to understand what it is. So,
I sent a text out to it.
what's that?
I told you I wasn't sure how to communicate, so I sent a text out, just so you know.
See, there you go. There you go. And then if anybody wants to jump into this picture real quick, we'll give you a little